just a heads up on that. There goes the key, informing everyone of the recording. The other thing we want to make sure that you do is if you're putting information or questions in the chat, make sure that your what would you call it? The name or what you have associated with you actually has your name as well as your organization. Because if, for example, someone just types in Steve has a question, we're not sure what agency Steve may be. So if you could put your name and then also your agency, if you don't already have that, that just makes it easier for the purposes of note taking. And then with that said, I'm Ahmad Brahmi. I will be hosting or emceeing today's call. I'm a division manager here with the County Department of Behavioral Health. Been a long time participant listener on these calls. And so today I'm going to go ahead and get our agenda moving. And I'm going to turn it over to Joe Prado from the Department of Public Health to provide us with the vaccine update. Joe, if you're ready to take it away.
Great. Thank you so much, Ahmad. Thank you so much for having me here today. So let's bring you up to speed on vaccines. And we're going to talk a little bit about a new youth data dashboard we have available. We're going to talk about booster shots as well. What our plan is for those booster shots. So first of all, our overall Fresno County total population is about 50% has been vaccinated. Our eligible population is approximately 60%. And when you look at our dashboard, we have our immunization dashboard on there. When you evaluate that and you compare it to the state, when you compare it to CDC, you're going to see a little difference in percentage points. CDC is using the census number from 2019 or so. And so we're using the Department of Finance projected population of 2021. And so our denominator is greater than the others. And so you'll see our percentage is a little bit lower. So we're taking a more conservative approach in our estimation of vaccinated population. At the very end, we'll do a final analysis and we'll align with everybody else. But so when you see and hear these percentages, there's always a little bit of a difference there. And it's fully vaccinated. 41% of our total population is fully vaccinated. About 50% of the eligible population is fully vaccinated. Another piece that we get a lot of questions on is the 12 to 17 years old. About 36% have received one dose, and about 9% are fully vaccinated in the 12 to 17. We're starting to break down the 12 to 17 even more so. So if we look at the 12 to 13 ages, their total amount of percent of their population receiving one dose is about 28%. And then the 14 to 17-year-olds, about 46% has actually received one dose. So this is just to help you and assisting you when you're doing your outreach and your education. If you start, if you are with the 12 to 13-year-old population that are eligible, definitely have a conversation with them about getting vaccinated. As all these children are back to school now, we want to make sure all of them have all the latest information on vaccine there. 65 and over, 87% one dose, and 75% are fully vaccinated in the 65 and over population. Our youth dashboard, and our team will put the link on with the youth dashboard there. You can access that through our main web page. You go to our COVID page, click on COVID data, and you're going to be able to see a youth dashboard there. What we're doing is that is not a state dashboard. We are running those calculations on a weekly basis. We will update it every Friday with what those numbers are. And so you're going to see a 90-day trend, and you'll be able to see broken up between each age group from the beginning of the pandemic. What is the total amount of cases that we've had? We do have some demographic information on that dashboard. And so you'll be able to see where close contact, where are the younger population actually getting infected by. And overwhelming, I want to say close to 80% of the infection to youth as of the date of the dashboard is really, it's happening at the household. So those are adults, those are eligible population around the younger children here that are really, that's where the infection is happening. We do have a school on the close contact there. I think it accounts for like 1%. But we're going to be monitoring that closely throughout these next months here to see what happens there. And of course, that data is driven by people responding to our contact tracers, responding to our surveys and our emails and text messages. So the better data we get is when people actually respond to us. So we want to make sure that's a good reflection of what's happening in our community. In addition to the youth dashboard, what else is available on there is by city. So you're able to see by city exactly what the % of cases are going up in a particular city. So this is strictly youth under 18 years of age that this dashboard is up. Hopefully tomorrow we're going to add a hospitalized and intensive care unit numbers to that dashboard. That will be a point in time graph. There will be a date of how many children under 18 pediatric cases we had COVID positive hospitalized and in ICU. You'll see that on an ongoing basis as we'll be tracking that as we kind of move along this response here. Booster shots. So the CDC did make an announcement. They're planning to do booster shots the week of September 20th. It still needs to be approved by the FDA, so we will wait to see on the FDA approval. But regardless of that, we will start to evaluate a mass vaccination site, adding one more to the system. Currently, we have UCSF out at their Shaw site across from Fashion Fair Mall at the UC Merced building. They are out there 7 days a week. That's our major mass vac site there. And so we're looking at adding one more just in case the week of September 20th to address the boosters there. My turn was just updated today to add with additional dose being added to the platform. So currently, immunocompromised individuals can receive a booster today. And so with my turn being updated, it's a click of additional dose, and you can go through your registration process. So my turn is the best way to get your vaccine appointment. It's being updated as we kind of progress through the booster phase here, and we'll see how that kind of runs along there. And that is my update for the group today. Thank you so much, Ahmad.
Hey, Joe, there was a question in the chat about does the department have plans, or are there plans for just regular flu vaccines and flu shots?
Yeah, definitely. So we usually start getting our flu vaccine supply either late September or early October. So we definitely plan on doing flu vaccine clinics. Whether we join them with offer COVID vaccine at the same site, we'll assess that and see. We've got our team kind of working through those logistics, but we definitely plan on doing flu clinics as well.
There was one other question, Joe, because I think we still got a couple minutes, hopefully, with you before we got to bring on Dr. Bond, which was, is there going to be any type of priority for those shots besides the immune compromise? And I'm thinking they may be referencing to the actual vaccines, the COVID vaccine. So I think you said that hopefully the boosters will become available in late September. Is there?
Yeah.
Is it for right now pretty much limited to immune compromised individuals?
Yeah, right now it's limited to immune compromised. Now there is not a requirement for a doctor's note. You pretty much have a conversation with whoever your vaccine provider is, let them know your situation, and then they could vaccinate you. But there isn't a requirement for a doctor's note if you're immunocompromised and need the shot today. Moving forward with general public, the recommendation, I believe, is 8 months after your second dose to actually get a booster. So depending on where you land with that, ideally, great if you please bring your vaccine card to a vaccine provider. It ideally is go to the same vaccine provider that you actually received your first dose. And if you got it at the fairgrounds, the fairgrounds won't be open in a mass vax way, but you can get your Pfizer doses, your Moderna doses at any other one of our providers. And so we'll have that on my turn on whether or not they're providing Pfizer or Moderna. And so definitely get that information, bring your vaccine card. If you don't have your vaccine card, there's going to be a lot of leeway with individuals when September 20th comes based on the state direction at this time. So you could still get vaccinated if you don't have your card, but please find your card, get that information so it'd be a smoother process.
I want to make sure that we're able to get to them. We have a couple more questions in there. So I'm going to throw one more at you, Joe. And then
Sure.
what we'll do is try to respond to some of the other questions in the notes that'll go out to everyone, because I want to make sure we get through the agenda. So the other quick question, if you are able to answer it, if not, totally understand, which is, does the COVID vaccine efficacy lower if they get another vaccine in that, like in that same like week to 2 week period?
Yeah,
Do
there's
you
no
have another
indication.
response to that?
Yeah, there's no indication of that at this
Okay.
time from the literature we have right now. Dr. Bond's coming on. If he has some more information, he could probably answer that better.
Sure.
I see the other question in regards to age-based approach to additional doses. No, that is not the direction right now for the boosters. There is so much supply available in the entire system, and the state has not mentioned that as of yet. So I don't expect there to be an age-based approach when boosters become available in 920.
Perfect. With that said, Joe, we're gonna, if there's some additional questions, we'll reach out to public health and try to get those answered so that we can put those in the notes. That'll go out to everyone. I do want to thank you for your time jumping on here, Joe. I know you're super busy. And making time to get on these calls, I think every 2 weeks is really, really beneficial and useful for folks. I also want to make sure that we bring on, as you mentioned, Dr. Bond, to be able to speak about kids and the COVID-19 vaccine. For me personally, when I have a question about kids' vaccines, we do reach out to Dr. Bond, but in my family, we reach out to the other Dr. Bond. Dr. Bond's wife is our family pediatrician, so we do contact their office a lot. But with that said, we're going to turn it over to Dr. Kenny Bond, Assistant Clinical Professor at UCSF, to be able to give us some information on kids and the COVID-19 vaccine. Dr. Bond, are you ready to kick it off?
Yeah, happy to talk here. So couple notes. Yes, as you mentioned, I'm full disclosure. I'm of course married to a pediatrician, so we talk about vaccines all day and night, whether it's in one job or another. So, and we talk about different age groups and all this stuff. So I am an emergency medicine physician by training, but I'm assistant dean and director of our Mobile Heal COVID Equity Project for UCSF Fresno. So running the mass vaccination site. I'm on site right now doing vaccines as we speak. So just a couple additional comments on what was mentioned earlier was absolutely, when we're talking about like co-vaccinating with other vaccines nearby, there's been studies that show that your response is the same, and that we do have specific rules for when COVID vaccines can be administered when you get your second dose or a third booster, hence the 8 months and other aspects. But when you're talking about flu shots and other vaccines with kids, they can not only be put together, but co-administered, just like we do with other vaccines. Sometimes you might talk to your pediatrician or your family medicine doctor about how many vaccines you can get with kids. A lot of it is actually just tolerance. They're not so much the response would be fine, but some of it is just that, you know, some of them will make you a little irritable, have some pain, and do you really want to have 8 shots on one day kind of thing. So sometimes they are spaced out, but it's not but just to clarify, almost none of that is based on immune response. That's based on sort of parent tolerance and child tolerance of that. So there's different factors that place into that, but certainly a great question when you're concerned with kids vaccines and kids getting back to school, and many kids in our county sort of being behind on vaccines as we have now reopened schools across the school districts. So let me see if there was any other questions in the chat. If you're able to pull them off, I'm happy to answer chat questions as well.
There was one that just came up, Dr. Bond, that it says a little bit off topic, but I think you would be one of the people that would be able to answer it, whether it's for kids or not. And it had to be a question about how effective or the efficacy of the over-the-counter tests. And it says, are we still not recommending rapid tests due to the false negative results and the lack of tracking with the OTC results? So not directly related to kids, but just, I think the question is, you know, should people be relying on those rapid or home tests?
It's a great question, actually. And it's something we struggle with, and more evidence comes out. As we study these more and more, initially, a lot of the rapid tests, when they came out in vitro, which meant with like in case studies, they showed that they had fairly decent sensitivity. Once we actually saw them out in COVID with actual COVID cases that were significantly going through the community, we saw that their sensitivity, in particular with asymptomatic patients, like we're talking about screenings, or that they were down to somewhere in the neighborhood of 50-50, which is really terrible, a flip of a coin where you're missing half the cases. Also, the reporting structure is a little bit different for, as you mentioned, with tracking. We can't also pull them and do you know, checking for DNA sequencing to see which is Delta variants or other variants. So we really generally discourage over-the-counter rapid antigen testing. We do have antigen testing on site here. We have the Binacs now, which are the ones that are provided by the county. We will provide them on request only with a concurrent PCR test. So if someone really wants to act quickly or have peace of mind, but we don't want it to be a pass to be like, oh, you're negative, you're safe to go out and see your family member or anything, because time and time again, we've seen that those tests are extremely insensitive. They're fairly specific, meaning if they're positive, you probably have COVID. The problem is that they're negative so many times and the PCR tests are coming back positive. So they're just really unreliable in that sense. So I have a lot of mixed feelings about it. I still get a lot of demand for them and requests for them. And since the county's providing them, if they encourage people to come out and additionally get a PCR test, I will offer them in those cases. But I think in general, from a health recommendation, our PCR tests also a year ago were so far behind. Labs have been slowly catching up now, where most PCR tests are turned around in under 48 hours. And when they were a week out, the rapid test had better utility since you had such a delay in the PCR results. But now that we're getting tests back in 1 to 2 days, they just have a lot less use, I think. I don't know if I can go more onto testing, but happy to talk about it, but I'll probably digress onto a little talk on pediatrics here.
There's a question along the way with pediatrics that I want to make sure we touch on, and it was, do you have recommendations for how for providers to talk to parents who may be on the fence about getting their kids vaccinated?
Absolutely. So as Joe had mentioned earlier, that our vaccination rates amongst the adolescents, the 12 to 17 right now, are really below the rest of the population. Some of that has to do with when the vaccines were released, but truthfully, a lot of it has to do with hesitancy with parents and hesitancy with getting kids vaccinated. The most common concerns that I have that parents come up, they kind of come in twofold. One is sort of a general fear of vaccines, right? They fear the same fears that adults are having. And some of them are really unfounded and not scientifically based. They are a lot of mis and disinformation spread about, fear of autism, fear of other things, fear of lead and other items and mercury and other things that are that are general fears from other vaccines that they've had that have been propagated over many years by a lot of anti-vax groups. So that's one aspect. The second aspects have to do specifically with some data on COVID vaccines that happen in children. The most common have to do with multi-inflammatory systems that pediatricians will refer to it as MIS in the healthcare industry. But just for the general public, what that means is that when you get a vaccine, your body is forming an immune response, right? That's how you get the antibodies and that's how you get the resistance. In children have really, and adolescents, they have really healthy and sometimes overly healthy and overly eager immune responses. So they have a higher rate of having a high immune response, which is why we're always, even with the new pediatric trials going on right now, we're always trying to confirm dosing, which is not just weight-based, but based on their specific immune response. I'll give a very specific example that I think is really helpful in the way I talk to parents is I'll talk about like myocarditis, which is one aspect of an inflammatory response that can happen with COVID and COVID vaccines. Is that there's a concern, for those who don't know, that with COVID vaccines, there's some case reports about having inflammation in the heart tissue after getting a COVID vaccine. Having said that, it's interesting because what almost no parents know is that coronaviruses as a whole, COVID specifically, have very high rates of inflammatory responses, in particularly with MIS and myocarditis. So the thing they're worried about with the vaccine is actually much more likely to happen with catching a COVID infection. Getting myocarditis, the very specific example of myocarditis is you are 6 times more likely to get myocarditis from getting coronavirus infection than from getting the vaccine itself. So the interesting thing is the way parents look at things is that they view things often as I'm worried about these very, very, very small side effects from the COVID vaccine, but they don't look at the risk of getting coronavirus. Like it's not a comparative. Their comparative is that I have a compare of getting a COVID vaccine or not getting a COVID vaccine, as opposed to getting a COVID vaccine and the 30% chance my kid's going to get coronavirus, or 50% or whatever percentage you think is going to happen over the next year from being unvaccinated, in particular with return to live schools and, in-class learning and stuff this year, and Delta variant happening all concurrently at the same time, where it's just ripe for spreading infection. So, and, we talked about, many times in the past with pediatric infections and kids having a significantly lower mortality and morbidity with COVID infections. Yes, that is still true, but with Delta variant, we have seen a significant increase in significant infections amongst those children, both school age and adolescent, both young and older kids. So just people don't look at it as a either or. They look at it as, I'll get my COVID vaccine or I'll just be safe, as opposed to, no, you're looking at the risk of, the very small risk of getting a COVID vaccine, side effects versus the significant risk of getting COVID in a school setting or communal setting where it's being spread right now. And talking to parents really have to look at that side by side. And I think that's the most helpful thing, looking at MIS, looking at these inflammatory systems and how they really are such high rates with COVID vaccine, with the COVID infections, and that kids are really not just looking at harboring infections for adults and spreading it. They're not just asymptomatic spreaders. Yes, that is true. They have a high rate of asymptomatic infections, but that they also have a much significant risk of getting infected now and being significantly ill. Not only that, but every single myocarditis case that's been published nationally, and we've seen anecdotally here, they've had 100% recovery. They're temporary in vaccinations. You get a little sick and then you feel better, but the significant cases are happening from COVID infections. So really not campaigning that I don't want you to spread fear, but just being realistic about what the real risk of side effects. I always use the analogy of it's a seatbelt in a car accident. Is it going to stop 100% of all deaths from car accidents? Absolutely not, but it's our number one mitigation of preventing significant injury and death. But you're always going to have people who are going to go out there and be like, I drive every day without a seatbelt and I've never been killed. Or gosh, my friend he wore a seatbelt and he died with the seatbelt on. And it's but nobody with, using any sort of logic would say, gosh, that seatbelt is unsafe, or it's not efficacious, or there's a 0% chance or risk. Nothing in life, unfortunately, is 100 or 0%. So I just try to use, that's the number one go-to when I talk about the fear and concerns and then with the adult concerns, as I segue as the very beginning, there is still this whole concern that is sort of unbased on things like autism being the best one, or certain other diseases that have been linked but debunked, but there's really no scientific evidence. And we can talk about how do we talk about with parents about who have fears for things that don't have evidentiary support for it, which is, I don't think I can cover in 10 minutes, but I would say that that's something that family medicine doctors and pediatricians have been doing for, their entire career, probably, truthfully. Thanks for the comment, Emily. By the way, it's good to hear from you. I'll pause for a second for other comments. I'm going to look at the chat here. I know there's a concern about 5 to 11s. I can talk about that for a minute as well.
Yeah, if you can, because I think that's where the next question for a lot of families and with students returning to school, the younger ones that haven't been vaccinated yet, or the vaccine not being available, of what is their risk factors, and is there any I think that was the question that is coming, as far as when do we think that could be potentially available for that, I don't know, the 5 to 11.
Yeah, so just as, and Joe may add on to this, but just the comment that if you look at infections within the schools, at least at the end of last year, when most schools were going back to in-person, at least with certain school districts, not all, we showed that there wasn't actually significant spread among school systems if kids were basically masked and basic precautions were being done, and that a lot of the spread was happening in the community. This is a separate talk about masking in school districts and stuff like that, but we showed, at least before Delta variant came out, that if you take precautions, that we can really do fairly decent mitigation strategies that really reduce the risk of spread. And that's basically, reducing the gatherings, keeping masks on, very, very basic things, hand washing, cleaning, simple things that really do a lot of good in prevention. Second, so Delta obviously is significantly more infectious, and then there's other variations. So we're going to look at how that works in the school setting. But I mean, I work in healthcare. I work in an in-place setting all the time. And, even amongst our healthcare settings, you look at infection amongst healthcare settings at the hospitals, and it's almost exclusively happening in community spread. It's not happening in healthcare settings where we're working with highly infectious, high infectious load, high like close contact things. If you're taking precautions, you're generally safe. It's really unmasked, sitting around close contact that's really the spread of COVID. Now, just to digress to talk about 5 to 11-year-olds and the 6 month to 4-year-olds, as you guys know, trials are currently happening with those 6-month-old to 11-year-olds for mainly Pfizer and Moderna right now, though J&J is also getting on board with that, though Pfizer and Moderna seem to be the most ahead. Those groups are split up into 2 different age groups because they actually have 2 different vaccine doses. One is the 6-month to 4-year-olds, and the second is the 5 to 11-year-olds. Pfizer has publicly said that they will have data ready, the 2-month safety data, to apply for an EUA, just like they did with the adults in September, so next month. So, and they will be submitting their application. There has been some statements from the FDA, and this is a point of contention amongst the FDA, about whether they needed more data than the 2 months for EUA, whether they wanted 4 to 6 months, additional data for safety, whether they wanted to skip EUA and go to full FDA approval. There was a debate about this happening, in particular a month or 2 ago, before Delta had really spread across, that amongst kids that have such a low morbidity rate that we really wanted to have more data so to capture how much any inflammatory syndromes such as myocarditis that are happening within these within this vaccine data. Now, I don't work for the FDA, full disclosure, so it's still not a done deal, but Pfizer has officially said that they will be submitting when they complete their data in September for EUA, which normally with the adults took 2 weeks in order to get full approval, get EUA approval for them. I apologize. Now the FDA is the data is constantly changing, so we don't know what the FDA is going to do with it. I find it hard pressed to say that the FDA will not, with the current Delta spread and the more significant morbidity happening in kids, that they won't be forced to review it just like they did with adults with an EUA approval. And so my prediction is right around the same time that we're approved a 3rd dosing and get full FDA approval around that mid-September, September 20th, at that point, that early September, Pfizer will be submitting data. And then by sometime mid or late September, that the FDA will be reviewing and approving EUA approval for the 5 to 11-year-olds. The 6-month to 4-year-olds are a later pool to get data on, and my prediction is that won't happen until 2022, probably early next year. I'll pause for a second for questions and look at the chat. Sorry, I'm a typical.
No, that's great. I think that hits on a couple of the questions that we saw. I know we've got limited time, and I think people could have questions for you all day long, Dr. Bond, and really try to learn and understand. I see there's one that I think you kind of touched on. There was a question as far as could the vaccine have any kind of impact on children that are still developing? So is there any risk in terms of the vaccine, which I think you kind of touched on? The science doesn't really support that, but have you heard anything as far as that being a risk factor of, because the child is still developing, to have a vaccine like this?
Yeah, absolutely. There's always concern with any development of any drug that we don't, we look at the safety in the short term, and absolutely we track all any new drug, vaccines or otherwise, over their long-term impact, and looking at, in children in particular, developmental issues. Having said that, there's no precedent that we would expect that there be developmental issues that would be occurring. We don't get that till much significantly later. That's just being straightforwardly honest with that, you know. But we do look at immediate effects and don't see any behavioral issues or anything, developmental issues happening acutely, though obviously so much of that needs long-term data to do that. That shouldn't, but that does not mean that you should be holding reviews of medications for 10 years of trial data on it, because we do look at the data for any medication when they first come out, that they continue to look at data on pediatrics data for the next 10, 20 years, looking at what the long-term outcomes are for that. I will mention that I did see a comment on childbearing and fertility, and that is one of these things where there's a little bit of dis and misinformation on, where there's a fear that there's effect on childbearing. And I will comment that there is zero evidence that any COVID vaccine has any negative effects on childbearing or fertility. Interestingly enough, it's anecdotal and case-based, so there's not a lot, but there are people that have had fertility issues secondarily to COVID infections. So the American College of Obstetrics and Gynecology, the Reproductive, Endocrine, and Infertility Associations, both of them have come out with statements saying that those who are considering or concerned about fertility and childbearing, that they recommend getting COVID vaccines, and that there's very likely more risk of infertility from not getting vaccinated than any perceived or potential risk, though it's probably zero, of fertility issues related to getting the COVID vaccine. And the information that's pushed out on fertility with COVID vaccine has been debunked and is, I hate using the term for various political influence, but is essentially fake news that is being pushed by mis and disinformation campaigns. And to query that with the pregnancy aspect is that, and sorry, this isn't quite pediatric, but OB is, all ties together. It's how we get kids, is my understanding. I guess I'm a doctor, so I should know that, right? But with pregnancies, that just so you know, with the very first, when we trialed that initial trials for Pfizer, Moderna, and J&J, they didn't enroll pregnant patients initially, but interestingly enough, thousands of patients got pregnant during their trials. I kind of joke that, what happened in lockdown and everything during that time is pregnancies happened because, we were trapped at home. And so, that there wasn't much else to do. So pregnancy happened while people were in those trials, and that they looked at that subset of pregnancies and didn't knock them out of the trial. So we actually ended up enrolling a lot of pregnancy patients with those initial trials, not by accident, but incidentally. And they showed a good safety efficacy, both with the mom and with looking at those kids and looking at the pregnancies with preterm birth and all the considered risks that you might worry about with pregnancy, and didn't show any change in outcomes with pregnant patients.
Perfect. Well, not that, but I mean, perfect response to being able to get to those. I think if there's any questions we missed, I think we did cover all of them, but if we did miss any, we will try to get those responses and include those in the notes that I mentioned that'll go out tomorrow to all the partners and everyone signed up on this listserv. I want to thank Dr. Bond so much for coming on, and also for all the work you've been doing throughout this entire COVID pandemic. Do you see your work on the news and on UCSF's social feed and things like that, and you guys are out and about doing a lot of great work, so thank you for that, and thank you for making time today for this group and being able to answer some of our questions. We're gonna bring on Rosemary Amaroff, our health educator and public health partner, who does provide us with a lot of great updates. And so, Rosemary, if you're ready, we're going to go ahead and turn that over to you. And like I said, for anyone, if you've got other questions for Dr. Bond that maybe you didn't get a chance to ask, go ahead and put them in the chats, and we'll do our best to try to find those answers. But with that said, I want to turn it over to Rosemary and make sure that we have time for Rosemary to give us an update, as well as also be able to get to some questions and answers later on about workplace vaccine mandates and some of those updates as well. So, Rosemary, take it away.
Good morning. Can you hear me, Amat?
Yes, I can.
Great. Thank you. Awesome. Good morning, everybody. And thank you, Dr. Bond. I learned a lot just from your presentation. This is great. So I'm going to, if we can go to the next slide, I'm going to go over some COVID numbers and give you kind of a view of how much of an increase we've had over the last month since the last time we met. So as of August 13th, the number of COVID cases was at 108,193, which is an increase of 5,518 cases since a month ago. And our state data, we've processed another 95,843 tests results since we last reported as well. Unfortunately, we've had another additional 23 deaths registered to COVID, and our COVID local hospitalizations continue to increase and change daily. On this slide we have, which is dated August 13th, was at 265. If you pay attention to that number, I'll show you in a couple of slides how much we've increased in the hospitals. Next slide. Our positivity. So the positivity rate and case rate obviously continues to increase. Positivity rate has increased to 10.9. I reported 2.7 last month, and the case rate is currently 29.7. and it was 2.7 as well last month. So as we strive to increase our vaccination rates, our COVID-19 prevention tips are still very important, as Dr. Bond talked about, with the masking, washing your hands, watching your distance, and be wary of crowds. And of course, we want folks to get vaccinated. I also wanted to mention too, for those of you that are interested in local school COVID data resources, it's come to my attention, some of the larger school districts like Central and Clovis, they have their own COVID dashboards on their websites. So I encourage folks to go check those out if they're interested. Next slide. Okay, here's our hospital data. As I've mentioned to you earlier, we've seen some big time increases in our hospitals, unfortunately. As of yesterday, we were at 310, and for positives in the hospital was 265 on August 13th. And as indicated, there are 56 ICU positive patients and 14 ICU beds available. They're also very busy with a lot of trauma and injuries and some heat-related illnesses that we've been hearing about in the news. So that just compounds the problem with the hospitals right now. And if someone has a post-vaccine infection and the person does end up in the hospital, many times it's also because they're suffering from other underlying medical conditions. But most people that are in the hospital are unvaccinated. And I also wanted to mention, if you hadn't heard already, our EMS has initiated an assess and refer again with their paramedics to reduce emergency room visits for patients. And they're being, as appropriately, they're being referred to urgent cares or their primary care physicians. Next slide. I wanted to mention there's a lot of guidances that have come out recently, and I just wanted to bring them to your attention. And these are links to those So let me just go ahead and get started. So the first one is the CDPH Public Health Officer order vaccination verification for workers in schools. And then there's a Q&A for healthcare worker vaccine requirements. And then the next bullet is the CDPH Public Health Officer requirements for visitors in acute healthcare and long-term settings. The next one, CDPH also released a health officer order for healthcare worker protections in high-risk settings. And there's also a Q&A for that as well. The health department our local health department came out with some guidance for K through 12 return to school guidance on August 17th. I encourage you to check that out. We also, on August 13th, came out with a health advisory that advises best practices during the Delta variant surge. And this was sent to all of our healthcare providers to provide some best practices for them. And then on August 5th, the state released vaccine record guidelines and standards that I wanted to bring that to your attention as well. Something that just was brought to my attention last night and this morning is the state, and if Anna could put that link into the chat, the state came out with some new guidance in regards to what they call mega events in their blueprint business sector. If you all remember that document that I would share with you every once in a while, basically as of September 20th, events will be required to have vaccine proof or do a negative test. It'll be required as of September 20th. So I wanted to bring that to your attention. You can check that out on that link that Anna just shared. Next slide. And here's just a reminder, the importance of COVID right now with a dramatic increase in testing. We thought it would be good to share and to remind you all about the testing flyer that our staff had put together with everything all in one place, which is a really nice. And there will be, I think they're updating it right now, and there'll be an updated one next week for you all to go check out and download copies for yourselves. Next slide. And OptumServe testing. We have requested from the state to increase our capacity at our COVID testing sites for the states. And right now we were seeing, approximately maybe 100 a day, and now we're over 200 a day. So we've asked for that. And then there's been some changes as far as locations for these COVID testing facilities. So I encourage you to go check it out. And we put a list here on the slide of where they're currently located. And then there's also a phone number where you can call and a link as well. So I encourage you to have this information handy to provide information to the communities that you're serving who may have questions. Okay, these are some static COVID testing sites here in Fresno that I wanted to bring to your attention. And one is at the Arbor Fair on West Shaw and the Broadway Fair on West Shaw. So just pay attention to the address. One is 3310, and that's for Arbor Fair, and Broadway Fair is at 3333. So just check those out. Next slide. So Joe has did a fabulous job of going over the slides and everything, and so I won't go into too detail about that. But if you do receive folks who want to get the vaccine and don't know where to go, send them to their health clinics, their pharmacies, and the community vaccine events that you can find on our website. And that would be really great for to help us. And the immunocompromised patients or people that are eligible right now for that third dose, examples are the organ transplant patients, cancer patients, HIV patients. Those are your severe immunocompromised that they're trying to give priority to right now. And so my turn information on this slide is old, since Joe was able to find out that they have the third dose button on theirs on the my turn right now. So that's fabulous. And I also will recommend that you have some sort of documentation when you go, just so that there's no delays or confusion about, letting them know that you do have this immune compromised medical condition. Next slide. Okay, so these are, we just wanted to provide one update on our static vaccine sites. COVID Equity Project is now at the 550 East Shaw, which is at the Merced building across from the Fashion Fair. So we wanted to share that with everybody and remind folks. Next slide. And these are just some upcoming vaccine clinics that we wanted to share with you. So the first one on the left is from the Disability Equity Project, and they have some great opportunities for vaccines at the Valley Center for the Blind on Mondays and at the EPU Center on Fridays. And I encourage folks to share that with their families and friends and communities they serve. The middle flyer is for the Washington Elementary School in Fresno from 5 to 7:30. It's today, actually, from 5 p.m. to 7:30. And the event on the right is at Citrus Middle School in Orange Cove on August 20th from 3 to 8 p.m. So we're really trying to get out there in the rural communities as well as the urban. So we're really maximizing our opportunities for the families to get their COVID vaccine. Next slide. Okay, the flyer on the left is from Magnolia Commons in Fowler, which is today from 3 to 7. The middle flyer is for Cedar Courts in Fresno on August 23rd from 3 to 7. And these are, I should say, these are second dose vaccine clinics, but usually on the flyer, if they take walk-ins, then you can get your first dose as well. And let me see, where am I at? And the flyer on the right is for the second doses for the parks. And they are taking walk-ins. So if you wanted to get your first shot during these times, you could as well. Next slide. Okay. And the left is Trinity Lutheran Church in Fresno on August 27th from 5 to 8. The middle flyer is from Viking Village in Fresno, August 27th from 3 to 7. And the flyer on the right is for San Joaquin Community Center in San Joaquin on August 25th from 5 to 7. Next slide. We have a lot of, oh, my flyers. Okay. We have a lot of second dose vaccine events. This is great. Okay. So the last set of flyers. The flyer on the left is for the Assembly Group Conference Center in Fresno on September 3rd from 9:30 a.m. to 12:30 p.m. Middle flyer is Reedley College in Reedley on August 31st from 9 to 2. The flyer on the right is Hoover High School in Fresno on September 3rd from 3 p.m. to 6 p.m. And if any of these flyers are of interest to you, please go to our vaccine page and download and help us to disseminate. We also encourage you all to put these flyers on your social media platforms. as a way of reaching out to the communities you're serving. Next slide. And because of the testing positivity is so high right now, we thought it was time to circle back and remind folks about education materials to provide guidance for isolation and quarantine. And we also wanted to share a flyer on the right about what to do when you've been exposed. And if Anna can put those PDFs in the chat, that would be great. We don't have a link for them, but these would be great to have handy for family, friends, in the communities you serve. And so I wanted to make sure to share that with everybody as a reminder. I haven't looked at those in a long time myself, so I've had to go back and look. And next slide. The department has received a new federal grant for health literacy, we're focusing on the west side rural areas such as Firebaugh, Mendota, Kalinga, and Huron. And we're beginning to compile some existing materials that focus on COVID-19, preventative care, chronic disease, communication with your primary doctor, and social determinants of health. The initial phase of the grant is researching the existing materials. And if you have any of these materials that you would like to share, please send them to Karen Kitchen, who's assisting us with this grant. And the email address is on the slide. This is going to help us determine what gaps there may be currently with these types of materials here locally, and then develop some materials to address those gaps. And we should also mention that the City of Fresno and West Family Resource Center, Central La Familia, Reading and Beyond, and the Jakara movement, and pardon me if I've missed any of the partners, but these are all great partners. And they also, I think it was the funding went to the City of Fresno, and they have the same grant. And so they'll be doing similar work. And we look forward to any kind of collaboration, coordination that we can do in the future. And this is going to be a great way to maximize our reach throughout the county, since they'll be focusing on urban and we're going to be focusing on the rural. So next slide. And we just added one new link to the resource link slides, and we added the Fresno County Youth COVID-19 case dashboard. So if you can go there and click on that. And usually, if it's in the PowerPoint, you just kind of hover over the link, and then you do a control, and then you click on your mouse and you can bring it up. And then I think that's it for me today. I thank you so much for your time, and let me know if there's any questions.
Thank you, Rosemary. Excellent job on the updates. Some really, I think, useful assets and graphics in there. So I know we're gonna, from the behavioral health side, try to share those all across our social media platforms as well. Excellent job getting through a really robust update and on time. So fantastic.
Oh, well, I hope I wasn't too fast.
Fantastic. And I still see in the chat, people are asking some of the questions, and some of the medical questions are being answered by Dr. Bond. So thank you so much, Dr. Bond, for remaining on there and
Awesome.
answering some of those questions. Some really important questions, I think. We're gonna use the last portion of this to have you guys do facilitate some inquiries from the planning work group to find out a little bit more as far as what are the needs of our community partners. And then if time allows, we'll continue to have some of the chat and questions in the chat. But the work group wanted to ask 3 questions of our CBOs, and I think today we have about 182 different individuals on the call, probably representing as many different organizations in the community. And so as you can see on the slide, there is we're going to ask you guys to put your responses to the questions that we're going to show you in a second in the chat, and being able to utilize those responses, reviewing those, that'll help us drive and determine what are some of the presenters, some of the subjects, some of the experts we need to bring on to be able to help support and address some of your questions. So really important, if you can, to get as many people participating in that. Again, we'll ask you to put your responses in the chat. If you can, make sure your what would you call it? The name that appears for you has, your name and the agency. Again, if it just has a single name, like Mike that's great. Appreciate Mike's input, but we're not really able to sometimes put that response in context. So if you can, make sure your name and your agency is in there. And then with that said, we're going to pose these 3 questions to you all and ask you to provide some response if you can in the chat. And the first question, if you can go to the next slide, Ashley. Perfect. And the question is, what questions as an employer do you have on requiring vaccines for your employees? So this is really an HR question for a lot of entities. And some of our CBOs may not have, a full HR team or department. So this is a question as far as what, as an employer, what are the questions you have as far as the requirement? Some entities that fall under healthcare have some specific mandates from the state. Others don't. Some entities may not be clear as far as some of their sites or services may fall into the mandate. Some don't. So please, if you can put whatever your questions may be with regards to that, if you have questions as far as what are you required to do for vaccines, and that way we can get back to it. Yes, if you could put yes, as Linda put in the chat, if you can put, number 1, like 1 and a point, and then your question. That way we know if it's related to that. Question 2, 3, etc. So thank you, Linda, for that reminder. So that first question again is, what questions as an employer do you have on requiring vaccines for your employees? So if you can, go ahead and pose those questions if you can in the chat. If we can go to this second slide while people are working on their questions. And so the second question that we're hoping that you will be able to provide some or ask some questions for, that we can be able to assist in responding for you, is second question: how does a vaccine mandate affect you or raise concerns as employees? So a lot of different agencies have staff that have varying, what would you say, opinions. Some are vaccinated, some are not. Some have concerns that Dr. Bond has really addressed a lot of those. There's people that may have religious exemptions, etc. So how does a vaccine mandate affect you or raise concerns as an employee, as employees? So again, trying to figure out, is that an issue? And if you can put, number 2, and then the response to that question. And then we'll go to the third question on the screen, and you guys will have time to put those in there here in a second. But the third question is, what concerns or questions do you hear from your community or the persons you serve, clients, on whether your organization requires vaccination for employees? So are you hearing any questions? Are there concerns from the community of, hey, if I come to in-person services, and I'm immune compromised, am I going to be safe, or are my children going to be safe? So are you guys hearing those questions at all? Are you hearing people asking questions of, hey, do your staff have to be masked or vaccinated or things like that? So this again will help the work group identify persons that we can bring in that could really help answer those questions and help support your efforts. So I'll just real quickly go back over the questions, and we'll be wrapping it up here in a second. So what questions as an employer do you have? So that's number 1, on requiring vaccines for your employees. Question number 2 was, how does a vaccine mandate affect you or raise concerns as employees? Employees or employers, I'm thinking probably. And then number 3, what concerns or questions do you hear from your community or clients on whether your organization requires vaccinations for its employees? With that said, I want to thank everyone who participated on this call, taking the time out. I want to thank all of our panelists. It's really important to have those great community experts and subject matter experts to help inform all of us. I want to, on behalf of the Fresno County COVID community meeting, thank all of you for participating, supporting this effort, for the people that came on the call and shared some of their expertise. And just remember, we'll be trying to answer as many other questions and put the notes from this meeting and in the chat into a document that'll go out to everyone so that you'll be able to reference those. I don't think there's anything else we have today. With that said, we'll see you at the next call, which is slated for the 16th. Thank you, everyone, and have a great day.